All right, let's jump right in. We're going to try and untangle this massive, complicated web of challenges that global health is facing right now. And, this isn't about just one disease or some problem in a country far away. This is about a whole series of crises that are all linked together, and they really do affect every single one of us.
This quote, it really just hits the nail on the head, doesn't it? The COVID-19 pandemic, it was way more than just a health crisis. It was like a global stress test, you know? It put pressure on everything and just exposed all these deep cracks in the foundation of our healthcare systems. It really pulled back the curtain and showed us just how fragile things are, especially for the most vulnerable people in the world.
Okay, so let's zoom out for a second and look at the big picture. We're living in a world where all these health crises are totally interconnected. You know that old idea that a problem over there won't affect us over here? Yeah, that's completely out the window. It's a myth. The truth is, we're all in this together, and our vulnerability is absolutely shared. The pandemic, it really wasn't just some random, unlucky event. A better way to think about it is like an X-ray. It didn't create the problems. It just showed us the deep-seated weaknesses and inequalities that were already lurking beneath the surface. Even the wealthiest countries were struggling, right? But for low and middle-income countries, what we call LMICs, it was just devastating. It took problems that had been around for decades and just magnified them. So how do we even begin to wrap our heads around all this complexity? Well, one helpful way to think about it is like a fight on three main fronts. These are the big three, the main drivers of our global health challenges: climate, disease, and conflict. And while they might seem separate, you're about to see just how deeply tangled up they really are.
First up, climate change. And look, we all know the term, but the key thing to focus on here is the role of human activity. This isn't just some natural cycle the Earth is going through. No, this is being sped up drastically by things we do, like burning fossil fuels and cutting down forests. And the consequences for our health, they're direct and they're severe.
And if you want a really stark example of what that means, look at this number, a predicted 1/3 drop in global food production by 2050. Just let that sink in. 1/3 less food. This goes way beyond being an environmental issue. This is a fundamental threat to our survival. Because less food means more malnutrition, it means weaker immune systems, and it leads to massive instability all over the globe. Okay, let's shift to that second front, disease. Now, in many developing nations, they're dealing with what's called the dual burden. What's that? Well, it means they're still battling the infectious diseases we've known about for a long time. Think HIV, tuberculosis, malaria. But at the exact same time, they're seeing this huge spike in chronic conditions like heart disease, cancer, and diabetes. So their healthcare systems are just getting squeezed from both sides, stretched to the absolute limit. And check this out, 71%. That's the percentage of all deaths worldwide caused by these non-communicable diseases. It's staggering. It's like a silent pandemic that's happening every single day. We tend to focus on the big, dramatic outbreaks that make the news. But these chronic conditions, they are by far the biggest killer on the planet, and they put a massive strain on healthcare resources absolutely everywhere. And that brings us to the third front. And this one, well, this one's on us. It's conflict. Wars and humanitarian crises, they do so much more than cause casualties on the battlefield. They systematically tear apart the very infrastructure that's supposed to keep people healthy. It's not a side effect. It's a direct assault on public health itself. Okay, so this is where things get really tangled. These three things we've been talking about, climate, disease, and conflict, they don't stay in their own lanes, not at all. They crash into each other. It's like a domino effect, a cascade of consequences where one crisis triggers another, and each one makes the others even worse. So what does that actually look like in the real world? Well, let's take conflict zones, like Ukraine and Gaza. Hospitals and clinics get destroyed. Medical supplies, they just run out. Doctors and nurses, the people we need most, are forced to run for their lives. Then you've got the immense psychological toll, PTSD, depression, and on top of all that, basic things we take for granted, like routine vaccinations for kids, they just stop. And that opens the door for old diseases to come roaring back. Now let's connect that back to the climate front. Natural disasters are getting more intense because of climate change, and they cause more than $500 billion in damage every single year. But forget the money for a second. Think about what happens after a flood or a massive storm. Sanitation systems are wrecked, water gets contaminated, people are crammed into crowded shelters. What have you just created? The absolute perfect breeding ground for disease outbreaks. You see?
It all feeds into itself.
So, yeah, it is really easy to feel, well, overwhelmed by all this. This web of crises can seem impossibly tangled, and you might be thinking, what can anyone even do? But that brings us to this single most important question. Is there a way out? What can we actually do on a global scale?
And the good news is, yes, there is a path forward. We're not just left with a list of problems. There's actually a blueprint for a healthier world, built on strategic global solutions. This table kind of lays it all out pretty clearly. For each one of these huge challenges, there are real, proposed solutions. For climate change, it's things like renewable energy and global agreements like the Paris Agreement. For emerging diseases, it's all about early detection and public awareness. For those chronic NCDs, it's health education and making sure people can actually get to a doctor. The key takeaway here is that these aren't just wishful thinking. They're actual, actionable strategies. But they all require us to work together. And that idea of working together, that's really the heart of the solution. We need stronger global partnerships because no single country can solve these problems alone. And right at the center of that has to be strengthening our international organizations, especially the World Health Organization, the WHO. But let's be honest, the WHO has its own set of huge challenges. Recent crises really put a spotlight on them. Sometimes coordination is fragmented. Funding from member countries can be totally inconsistent and just not enough. And way too often, individual national interests get put ahead of global health security. For the WHO to be truly effective, it needs more reliable support and, frankly, more authority to make the tough calls when a crisis hits. So, what does a stronger response actually look like? Well, the framework is pretty clear. First, you need global health security rules that everyone agrees to. Second, you need way better, faster surveillance systems to catch the next pandemic before it spirals out of control. Third, you've got to make sure that resources, like vaccines and treatments, are shared fairly. And the big one, the ultimate goal, is to keep pushing for universal health coverage so that every single person has access to the care they need. And this all brings us to our final and maybe our most important point. At the end of the day, this isn't just about policies and organizations. This is a call for a massive shift in our mindset, a total rethink of our collective responsibility to one another. Now, this is a really powerful quote, and it's a little provocative, right? The phrase one world order can sound pretty out there, maybe even a little utopian. But the point being made here is that this level of deep, committed global cooperation, it might just be the only real way to guarantee health for all. A pretty bold idea. And really, here's the bottom line. We've got to stop just reacting. We can't keep lurching from one crisis to the next, just putting out fires. The real goal is to shift from being reactive firefighters to being proactive architects. We need to build systems that get to the root causes of health inequity, the reasons why some people get sick and others stay healthy. It's all about building a foundation of resilience and fairness from the very beginning. So that leaves us with one final big question for you to think about. After seeing how all these crises are connected, how one problem fuels another, is this idea of a truly unified, healthier world just a utopian dream, or has it become an urgent, absolute necessity for our shared survival?